everyone to a new episode of the Untold. I'm really happy to be here and also joining with me my co-host Day. How are you?
I'm good. Thank you so much, Haba, and welcome, dear viewers, to this brand new episode. Of course, usually we get new guests every time, but today we have a guest who is showing up for the second time, and we're so happy to have him here, Dr. Mohamad AlMosawi. He's going to share with us a lot of his experience in his field. So basically, it's going to be a very interesting topic today.
Yes, indeed, especially when it comes into the medical field. Everyone is really excited to always know about the updates and everything in detail. So stay tuned with us.
All right, welcome back, dear viewers, to the studio. And of course, right now we have our dear guest, Mohamad AlMosawi, Dr. Mohamad AlMosawi, with us again in Untold. We're so happy to have you with us.
Thank you very much for having me again, and I'm really pleased to have you or to be here. Thank you very much.
It's always joyful and interesting to get to know more about Dr. Mohamad because he got a lot to say. The storytelling that previously we talked about, you missed it, dear viewers. Maybe if you haven't, then this is your second chance to get to know more about Dr. Mohamad, because he's a wonderful guy. You get to know and learn more with him every time. So right now we have Hiba with us.
Nice to meet you.
Yep.
Nice to meet you too.
So basically, just a brief before we get started about Dr. Mohamad AlMosawi. Who are you and what you do? And we know you for sure, but
thank you very much.
for the new viewers.
Well, simply if I say that I'm a consultant in internal medicine, I've already finished my education here in Kuwait in the high school, also in the university, and after that I've joined the board of internal medicine here in Kuwait and abroad. So simply I've been a consultant since more than, honestly speaking, I don't remember since how long.
Time goes fast.
But I can, yeah, really. So, but I can say at least like for the last 10 years.
So this is something very amazing, especially when it comes into a very hectic field. I'm very sure everyone has been asking you about the mpox since you're a doctor, so this is more of a topic. So we've seen so many things that actually happen. If we have a doctor in the family, it's always a phone call away when it comes into knowing about everything. So do tell us about, let's say, especially when it comes into having your interests and what excites you and motivates you more.
Being a physician and being here in Kuwait with the social life, I would say, it's a burden in the physician. Now, for example, all of you, know that whenever we have a family gathering, whenever we are in the Diwaniya, or whenever we have any other, I would say, any kind of gathering, the spot will be on you as a physician. People will start to ask many questions. Personally, I don't bother, or I don't really I would say, I will not be more than happy, or I will be more than happy to answer any question. But sometimes there will be a deep question to the extent that you need to examine the patient.
Right.
So which really sometimes happen, for example, to check the blood pressure or the blood sugar, especially if the Duani or the gathering having these tools. Or for example, I have them in the car. So this is something very common. Now, getting the information is something really important, and most of the time people will trust I would say, the true source of the medical information. Nowadays, with the social media, you all know that getting the true information would be difficult more and more. Unfortunately, the social media will have the true information and the fake information, the trustable, I would say, information, along with the non-trustable source of the medical information. So getting these information is really something very important, and the source of the information also is very important. We have Google. Everyone have Google, but to Google a medical information is totally different from doing shopping, or from finding a spare parts of your car. Simply, it's the source of the information which is very important nowadays.
Yes, indeed, and I do believe one of the most, let's say, questions is always related to the topic is, okay, doctor, I know I have to do, let's say, specific tests, but what if.
Yes.
What
What?
if?
Yes.
Which makes it really
You know, the
difficult.
correlation between, I would say, the medical test or the medical investigation result and the clinical situation is something very important. I always give this example to my patient that, many career, many jobs, they will disappear by time. For example, one of the commonest example is the typewriter. Who can imagine that the typewriter nowadays nobody's using it?
And
Only
if you let one of the new generation see this
yeah.
machine, oh, what is this?
Yeah, exactly. The same as the phone, the old style phone.
Yes, the old.
So these things, they are, one plus one equals two. These are solid information, I would say. But to correlate the outcome of the medical investigation or medical test along with the clinical presentation of the patient and knowing the history, I think it's something will be very difficult to the artificial intelligence. Now, we all know that AI or artificial intelligence, it will be the future of almost all the career. They are talking about even the pilot of the airplane, even the captain of any ship. It could be run by the AI, by the
So
artificial
they have
intelligence.
surgeries done by AI.
Exactly. But the surgeries, they are robotic surgery. And at the end of the day, the one who's controlling the robotic surgery is a physician
Right.
or a surgeon. Because, okay, the robotic surgeon or the robotic surgery machine will know how to do the procedure itself. But the consequences, I would say, of the procedure, this is something very important.
Do you think like we will need the AI in the future, even though it may take our jobs, but maybe for more precise work as a surgery, for instance, that it takes order from the physician, right?
Yes,
But in
exactly.
terms of being precise in the job itself, I think it's way better than.
Well, yes, because during, I would say, I'll give you a simple example since I'm not a surgeon, but I can give you a very simple example. That, for example, during the surgery, you might have a complication or you might have a minor bleeding. Now, the human, I would say, intelligence or the human brain can decide, does this bleeding, was it worth it to do another procedure or to interfere at the spot? So, deciding these, I would say, very critical medical decision is something very important. The same thing applies to any medical emergency. For example, in cases of emergency, the physician needs to take a very critical decision within a couple of minutes,
Right.
which is, I think, not will be or it will not be the same story or the same scenario with the artificial intelligence, because usually with the artificial intelligence you need to give the machine the information or the basic information, and then it will be analyzed. Okay, it might takes few seconds, but at the end of the day, few seconds will affect the life of any patient.
Yes,
That's right,
indeed.
that's
It's
right.
always a matter of seconds. So, talking more about the advanced update that's been happening in the medical field, especially specifically talking more about the internal medicine, maybe we'd like to elaborate more about that.
Yeah. Well, nowadays there are many, I would say, advanced in internal medicine. One of the simplest example I usually give my patient that in the past we were not able to detect or to diagnose any of the future complication of any disease. But nowadays, with the features or with the blood test of tumor marker, for example, we can detect that if the patient, he might have one of these diseases without having any symptom. So tumor marker is one of the, I would say, advance in the medical field. Another, I would say, a very huge advance is the genetic testing. Now, for example, by genetic testing, I can detect that such a patient might have a cardiac issue or a cardiac problem within the upcoming years, or he might have, I would say, any of the diseases that almost all the people nowadays concerned about, like for example, Alzheimer or Parkinson. That, for example, by studying of these genetics, I can detect whatever the age of the patient. Now, the question or the moral, I would say, question that if you diagnose a patient with Alzheimer and you said that within the upcoming 20 or 30 years you will have Alzheimer, Is there any treatment curable for Alzheimer?
We need that.
So this is really a very huge moral, and I would say it's more of an the ethics in the medical field. We all know that the medical field it's ruled by the ethics. Now, telling the patient that you might have such a disease within the upcoming 20 years and then having no cure or no treatment, I would say, except symptomatic treatment, this is a very huge issue. The second thing that, in the medical field or the internal medicine field, we have a lot of diagnostic tools that I would say, collaborate between the diagnostic and the intervention. So on the same time, it will be a diagnostic tools, but on the spot you can intervene or you can cure or you can treat. So it is treatment versus or with the diagnosis, which was not available. One of the simplest example is, for example, angiogram. Angiogram in the past we used to expose the patient to many radiation, and then even sometimes we give him some medication just to diagnose the abnormality. And then in another sit or another day, we will just use or treat the patient. Nowadays, you can do both of these procedure in the spot. So by this thing, you are decreasing the, I would say, complication of any procedure, and at the same time, the time consuming or the time of the patient will stay in the hospital, it will be reduced significantly.
Now, it's better for him also.
It's better for him, it's economical burden, and along with all other burden. We all know that nowadays, most of the diseases, it's not only a medical burden to the patient or the hospital. For example, some of the chronic diseases, it's more of a social burden to the family, even the government or I would say, the Ministry of Health or any, I would say, medical institute that will handle these cases. So by decreasing the time of staying in the hospital, you are doing much things, not only to the patient himself, to his family, even to the, I would say, burden as a part of the insurance or even Ministry of Health.
Right. So, Doctor, are there any emerging trends or areas of focus in internal medicine that you find particularly exciting or promising?
Well, let me talk about Kuwait in specific, or our social or our society in specific. We all know that Kuwait is considered to be in 2023 the third country, the highest third country in the world of having diabetes patients. But unfortunately, in 2024, we are now number 2. We were number 3, now we are number 2 in the population or percentage of the population who have diabetes. Now, focusing on the pre-diabetes, I would say education, trying to educate the population about diabetes and about even the complication of diabetes. We all know that the great mimicker, I would say, of almost all chronic diseases is diabetes, because one of the causes of ischemic heart disease, one of the causes of coronary artery disease, heart problem, CVAs, cerebrovascular accident, strokes, all of these, the uncontrolled diabetes is one of the, I would say, major challenges to us as a physician. Now, if we are trying to avoid these complications, so it's better to start in a very early stages. For example, I really, for myself, encourage to go to the schools, to go to the middle schools, educate the students
in an early age.
Very important. Exactly, about the disease itself. I've been doing this for the last, I would say, few years, that, for example, I would give some lectures, even at a very early stage. It's not, I would say, it's not a very complicated lecture, rather than having a simple a lecture with a very simple medical phrases, just to educate those students. And at the end of the day, he will go to his family, he will try to even to educate his mother and father, and vice versa.
That's right. All right. I guess that we have a lot to talk about today. So before we get into that, let's take this really quick break, and then we'll be back, dear viewers. Stay with us.
And we're back, dear viewers. Doctor, when we're talking more about people awareness, now this is something that happens, I'm very sure, everywhere. Now we've seen so many diseases that been up to the table, and something maybe it's new, especially if we're talking more about, let's say, some kind of, let's say, immune system disease and so on. This is one of the diseases that been, let's say, raising up high. So we have these certain people, once they hear about a certain new disease, I am the one who has the
Yes,
disease.
yes, exactly.
And it's more of, let's say, a challenge to
Ah.
make them understand that you're not facing that. That doesn't mean if it's happening, it's happening to you.
Exactly. And you know, the main problem, I would say, or the main issue is what will happen after hearing about a certain disease.
Right.
They'll start to malingering, or we call it malingering of the symptom. So they'll start to imagine, oh yeah, I have this and I have this. You know, I would tell you one of the jokes during medical school. One of the most diseases or one of the most complaint that medical student will have is to malinger the symptom. So for example, today we are talking about hypertension, and the tutor will start to speak about, you know, hypertension, the complication. The first thing that, you know, the first audience, which is the medical student,
Yes.
will start to malinger or to imagine that they have these things. Now, this is not the issue. The big issue or the huge issue, I would say, is what will happen after, you know, imagining that I'm having such a disease. The patient usually start to do what we call it the medical shopping.
Yes.
He will start to seek medical attention of, let's say, the primary physician, and then he will go to a more specialized physician, and then he will visit 1, 2, 3. But at the end of the day, what he will seek, that either someone will tell him that don't visit me again, you have nothing, or someone who will do more and more and more investigation. Now, talking about the ethics, that any physician who will think that by the time that patient will reach his clinic and he already have done almost all the medical, I would say, or the necessary medical test,
Yes.
no need to go further. You know, trying to convince the patient that you don't have anything or what symptom you have is really something very simple. Is really something, I would say, it's a challenge for the physician and even though for the patient or his family. One of the simplest example is, for example, headache. You know, we all know that headache is the most commonest symptom or sign that the patient will come and have a complaint along with backache or back pain. Now, headache, 90% of the headache is what we call a tension headache. Okay, you know, tension headache. It's either stress, irregular sleep, having too much, I would say, salt, or other food that might mimic the headache. But when the patient will be concerned about the headache, the first thing he will do, he will just go ahead and Google the causes of headache. And unfortunately, the first cause of headache which will be there in Google is, for example, brain tumor.
Yes.
So it will be implanted there in his mind. And he will start to visit more and more and more clinics. And by the end, if you don't do, like I would say, a CT scan or an MRI for the brain, he will not be convinced.
This
So-
is me. He's talking about me, by the way.
Well, no, it's,
This is what I usually do, and this is bad habit. It's really
And,
true.
You know, it's. I would say it's seeking the medical information from a trustable source. For example, once the patient will come complaining of a headache, then you should take a full history, examine the patient in details, trying to elaborate if there is any neurological sign or any sign that might, I would say, support your opinion as a physician that this is nothing. This is only a simple, stressful, or a stress headache or tension headache, we call it. So, and then you should, let's say, try to convince the patient that please, this is a very simple tension headache. No need to go further unless there are some neurological deficits.
Yes. And the most difficult patients are the one that Google everything and then come And it's like they're testing the doctors.
Yes,
like,
and they're
yeah,
prepared
but
for his
yes,
questions
but
and their answers.
Yes.
yes,
We call them, as a physician, we call them the semi-medical personnel. For example, he knows half of the information, but how to implant this true. And almost all the time, the information will be totally true information.
Right.
But how to elaborate this information into his clinical, I would say, situation, this is something very
Right.
important. Now, seeking medical help is really something very important. But the most important thing is to know when to seek this medical help. Now, for example, simple, I would say, example is the chest pain. Now, to know what is the source of the chest pain, what is even the nature of that chest pain, is it something significant? Is it something serious? Do I need to visit the medical doctor, or I will just neglect it? These question needs to be answered by the patient himself rather than by the physician. One of the huge problem, it's a worldwide problem, is the period of waiting in the ER, in the emergency room. And as you all know that, for example, in some of the countries, like for example in the UK, the time that usually will be spent in the ER is between 6 to 8 hours. Unfortunately, in other country, it's between 8 to 12 hours. Now, the physician should have, I would say, like a plan and into how to distinguish between this is a serious chest pain or this is a simple musculoskeletal chest pain without any complication. And even the patient, for example, if you are putting all the patient in the same tract, the simple upper respiratory tract infection with the serious chest pain, this is something unacceptable.
Indeed.
Yeah, for that reason, in every ER we have something what we call it the triage room, and the I would say the job
Checkup?
of it's simply the checkup. It's simply to know, oh, this is
Which one
serious,
is
so
more
this is red flag. Oh no, this is a cold case,
Yes, right.
so it's a green flag. So distinguishing between these cases is something very
Knowing
important.
which one is the priority.
You are right. You are right.
Now, let's talk about this is quite interesting here for us today because we in Kuwait, we most likely have lots of gyms and a lot of people go, do the sports, but they lack a proper diet and nutrition. And I guess we have to talk more about this because I guess, you could be going to the gym, but having bad habits, bad nutrition,
Exactly.
something else.
Exactly. And it will negatively implant or reflect on whatever you are doing, exercises or anything else. Now, doing or being under the supervision of a dietitian is something very important. Not only for people who goes to the gym, even for the people who have chronic diseases like diabetes, hypertension, high uric acid, ischemic heart disease. All of these or any of these diseases should have a very clear, I would say, diet plan. For example, let's talk about uric acid. So having gout or having an acute gout attack, for example, with acute painful tender joint is really something very important to have a clear diet plan to avoid red meat, to avoid, for example, tomato, fava beans. So all of these will reflect positively or negatively on your situation. The same thing also applies to people with diabetes. Taking care of your diet, having a specific amount of sugar in your diet, avoid a very high sugar, I would say diet is something very important. The same thing in the gym. We all know that almost all the people who goes to the gym, the main, I would say, aim of going to the gym is to reduce the weight
Losing weight.
or to build muscle. Now, building the muscle requires a very high protein diet. But for example, if you are having, I would say, a very high cholesterol level, and then you go to the gym and having what we call it an animal source of protein, this is not recommended. But in the same time, you can have the same amount of protein, but from a vegetable, I would say, source, or from a vegetarian source. So the protein is not only in the animal product, it might be in the animal product, also in the vegetarian product. Now, being a vegetarian here in Kuwait is really a very
Difficult.
it is. It
It's
is.
not difficult, it's expensive, to be honest. Like, this is the number one ranking
yeah.
problem. It's expensive.
Yes. Yes, despite the fact, being vegetarian, I would say outside Kuwait, it's much cheaper.
Right.
For example, we have some of the country, like for example in India, there is a huge percentage of the population which is vegetarian, and having the protein from a vegetarian, I would say, source should be much cheaper from the
Yeah, definitely.
animal
This is
source.
what I thought.
Yeah,
I
yeah.
think it's because of the market. Since there the demand is less, therefore everything has to be, let's say, very expensive. But when we have lots of people who are demanding,
yes.
this is when the
Yes.
market starts
Yes.
reducing that
Yes,
price
yes,
in
yes.
business itself. So when it comes into that, we've seen so many people do take this point, as we were talking
Yes.
now about the market and business and so on, to add it in the industry, even when it comes into the medical care itself. So we can see so many items, if it's not available in Kuwait, you will find people that have it for certain, let's say, pharmacies with that expensive amount. Different kind of, let's say, injuries could actually happen associating with that. So when it comes into this kind of, let's say, situation, I'm very sure you've been associated with it. You've noticed it. For instance, I had my brother. Unfortunately, he slipped from the stairs and he had some kind of broken bone in the back. So what was really scary is we wanted to find the case that he has to wear. It
yeah.
was very
The
difficult.
cast, yes,
Yes, it was
yes.
very difficult, very expensive. But we had to, let's say, just find it out in order for him to be adjusted. So these cases could actually happen, and unfortunately, we do see that coming.
Well, let me give you a very, I would say, interesting information that medical industry or drug industry, it is the third huge industry in the world after weapon and unfortunately drugs, So talking about the medical industry is really something very huge. During the recent year, there are many, I would say, advanced, not only in medication, not only even in the devices, not only in the devices that usually the elderly will use. For example, in the past, it was one of the major, I would say, obstacles with anyone who's having a bedridden patient at home is how to transfer that bedridden patient from the bed to the chair and then to the bathroom and then back or vice versa.
Yes.
But nowadays, with a very simple device and only one man to control that device, or even sometimes the patient, if he's conscious
Right.
himself.
and control and can
Yes.
control, I would say, his hands. So it's very simple to transfer that patient from his bed to the chair to the bathroom and vice versa. So these things, or for example, the advanced and the medical field is something required. One of the things that recently, during the recent year, we can see that people who have a stroke or brain stroke, the recovery period of those patients used to be years and years in the past, but nowadays it's only a matter, I would say, of months. So this is by the advance of the physiotherapy, using of a new advantage in the physiotherapy. One of the things that, for example, hydrotherapy, in the past, to have a patient going to hydrotherapy, physiotherapy, was extremely difficult, and he should have, I would say, a swimming pool at home. But nowadays, there is a portable swimming pool, which is a walkable swimming pool that the patient can use to recover from any of the
Everything is
complications.
accessible and
Yeah.
easy.
It is.
And hopefully in the future we get to see more of these.
Sure. But
Useful.
by the high demand, as Hiba said, once you have a high demand, then the price will go low,
Right.
and it will be more and more, I would say, easy for the
Indeed.
patient to get these helps.
All right, so I guess it saddens me to say this, but we ran, of course, out of time.
Yeah.
Eventually,
Really?
every time,
Come
time goes fast with you, Doctor.
Thank you very much.
We really appreciate your knowledge and information that you share with us, and of course with our dear audience. But with that said, we have to take this really quick break before we wrap the episode. So stay with us, dear viewers.
And with that, dear viewers, we reached towards the end of today's episode. I'm very sure you were really excited, especially knowing about the new updates that have been happening in the field itself.
Yep, and all the technology coming up, and all the information that we get to know from Doctor. He is very nice and very straightforward, and I love listening to his
Advice and everything
advices
he
and everything.
presents.
Yes, related to the medicine field. All right, so that was it. We hope you enjoyed it, dear viewers. Stay safe, and we hopefully get to see you again in another episode of The Untold. Goodbye.